Paul Golden again, and today I'm going to talk about a subject that's generally considered taboo in the mental illness area, and that's suicide. First, I'm going to talk about my personal experience, and then I'm going to do a little editorial. In my own case, over 45 years of having the bipolar disease, I made a serious attempt on my life once, and that was 6 years ago, 2012. I did not plan it. I came home from work feeling perfectly okay. There were a couple stressors at the office, nothing out of the ordinary. But I felt when I sat down in my chair in the living room that I was going to do something that was not good. I don't even think I really knew. But I did reach out and call all my family members and friends, and it went all to voicemail. I then went to my grandfather clock, which is off to my right, and on top, for defense purposes, retrieved a Taurus 6-shot pistol, revolver, loaded with .38 caliber silver tip hollow point bullets. I sat down in that chair and shot at my right lower leg, midway between the knee and the foot. I remember saying that really hurt more than I thought it would. Of course, I'd never done that before. I then turned the gun on myself, and I should have said before I started this video that I was going to be graphic, but that needs to be done on occasion, I think, in this area. That is, in affective disorders or diseases. I turned the gun on myself, shot myself through the abdomen. I don't remember anything after that because I guess I fell forward and became unconscious. I have to say that before I actually shot myself, I called 911 and told them I was going to shoot myself. The dispatcher asked why, and I said, I don't know why. I then gave them my address, and before I had done this shooting, I even unlocked the door. You could ask, well, did I really want to die? And the answer is yes. Here's more graphic. I did not do a headshot because it's too messy, traumatic for somebody who comes upon the victim. The next thing I remember was being in the ambulance and the text saying that my blood pressure was 57 and slapping me in the face, telling me to keep awake, Paul. And then I don't remember anything until the ER, when the ER doc I heard asking for 6 units of type-specific whole blood. I vaguely remember being rolled to the CT scanner on my stomach, prone, which is kind of unusual. And I remember saying the name of a friend of mine from Israel, Brock over and over again, and he's a friend who died near me when I was in Israel during the last Great War, the Yom Kippur War. The next thing I remember was waking up in ICU, a lot of pain all over. The trauma surgeon told me that the bullet had missed the spleen, had nicked the upper part of the left kidney, had bruised the colon, and exited the back, leaving quite a large exit wound. The orthopedic surgeon came over next and said that the bullet had pierced the large posterior tibial artery, and that's what probably almost took my life. And that he had called a vascular surgeon to fix that. The orthopedic surgeon then fixed the displaced fracture of the tibia with a rod. I was in the hospital for about 4 weeks, and 2 weeks after discharge, I was back to work in a wheelchair. The story was that I was in a car accident as a passenger. Now, to editorialize, Many years ago, I wrote an editorial for the Annals of Internal Medicine called A Way Out. This was about a dear patient of mine of 76 years of age, who I met actually when he was 70 and placed on dialysis. His only medical problem was arterial disease from hypertension. He was an avid golfer and reader. After 6 years on dialysis, at age 76, he decided he couldn't stand dialysis anymore, and he came to my office with his wife to discuss options. First, I talked to him about going to twice a week with more hours, twice a week with the same number of hours. What the heck? So his urea would be a little higher. And I told him he could stop dialysis. And his eyes opened widely, and he said, "I want to do that." And Ruth said, his wife, "No, you aren't." And I said, "Well, go, okay, think about it." And a week later, Ruth called and said that Dick had decided not to return to dialysis. So I arranged for hospice to see him. I had already explained to them that chronic dialysis is about the only chronic disease that, if either not started or stopped, leads to a painless death. So I began to think recently, what's the difference between not starting or stopping not only dialysis, but treatment or no treatment for any chronic incurable disease, say terminal cancer or emphysema requiring oxygen and frequent ventilator support, or cardiomyopathy, end-stage heart disease, not amenable or not a candidate for heart transplant. Do I think that the day will come that, like in 6 states, you can do, the doctors can perform, let me not say that, not perform, they can provide death with dignity, which I used to call physician-assisted dying. The public called physician-assisted suicide. I don't think it's suicide when you have a terminal illness. At any rate, do I think that the day will come when a patient in the middle of an acute severe depression will be supplied a lethal dose of pills to take it home when they just can't take it anymore? No. The rules right now for death with dignity are the person has to be considered terminal within 6 months, but really it could be any time period, because who knows? They have to have been considered this way by 2 physicians. They have to be of sound mind. How do you determine that without a psychiatrist? And once they've decided, gone through all this, they have 2 weeks waiting period. I emphasize that when they're given these pills, they do not take them in the office. They take them at home or wherever when they feel they want to, when their life is no quality because of, say, pain and cancer or breathing and heart failure. So now, as far as suicide, those long-termers like me, 45 years of dealing with bipolar disease, I never thought about suicide before, but I have to say now that if you've never experienced a major depression, if you've never been 6 feet under and alive, if you've never been 20,000 leagues beneath the sea, if you've never felt despair beyond despair, if you've never felt the indescribable, then you don't know what depression feels like. And you might not understand that people like me, or even people that have only had depression for a few years, might take comfort in the fact that there is a way out, namely suicide. So I don't think the public should look at suicide as a selfish act by the person. I don't think they should hush it up. I don't think that, it should remain in the darkness. For example, how many obituaries have you ever seen where it says such and such died unexpectedly on such and such a date, and he loved this, that, and the other, and he survived by this, that, and the other? Have you ever seen one where such and such died unexpectedly from a self-inflicted gunshot wound or just from suicide? I think that should end. The last thing I want to say is The people who are close to this individual or these individuals should not feel any guilt. It doesn't matter if they've tried and succeeded in having them see a psychiatrist or tried to have the individual stay on and not stop medications. Ultimately, the decision is that person. He makes the ultimate step. And sure, there's going to be, I mean, how can you avoid some short-term guilt? But I know people who felt guilty for the rest of their life, or 5 years, or feeling that they could have done something. Not right. I'll see you next time.